So today we're going to talk about the drug called Cefadroxil monohydrate. Cefadroxil monohydrate. One of the brands is Cefadrox. So the composition of the drug, of the capsule, this is a capsule that we are talking about. So each Cefadrox capsule, 500 milligrams, contains Cefadroxil monohydrate equivalent to 500 milligrams of Cefadroxil. So what are the indications of the drug? But before that, we will talk about the properties of Cefadroxil monohydrate. So Cefadroxil is a beta-lactam antibiotic, and it is bactericidal. So it's able to kill bacteria, and it acts similar to benzyl penicillin by inhibiting synthesis of the bacterial cell wall. So it acts in a similar manner to benzyl penicillin by inhibiting synthesis of the bacterial cell wall, and it is most active against gram-positive cocci and has moderate activity against some gram-negative bacilli. So it is most active against gram-positive cocci. Okay, most active against gram-positive cocci. So it is most active against gram-positive cocci and has moderate activity against gram-negative bacilli. So sensitive gram-positive cocci include both penicillinase-producing staphylococci. Although methicillin-resistant staph are usually resistant, most strep are also negative. So most streptococci are also sensitive, but not penicillin-resistant strep pneumoniae. And enterococci are usually resistant to Cefadroxil. And there are some gram-positive anaerobes that are also sensitive. And among the gram-negative bacteria, Cefadroxil has activity against some Enterobacteriaceae, including strains of Escherichia coli, E. coli, Klebsiella pneumoniae, Proteus mirabilis, Salmonella, and Shigella species. But not against Enterobacter, indole positive Proteus, or Serratia maricens. And it is also active against Haemophilus influenzae, Moraxella, or Branhamella catarrhalis, and Neisseria species. And it's also active against Bacteroides fragilis and Pseudomonas aeruginosa. It is also active against Haemophilus influenzae, Moraxella or Branhamella catarrhalis, and Neisseria species. But they are not, Bacteroides fragilis and Pseudomonas aeruginosa are not sensitive. And neither are Mycobacteria, Mycoplasma, and fungi. So it's not suitable to use Cefadroxil to treat Bacteroides, Pseudomonas, and Mycobacteria, Mycoplasma, and also the fungi infections. So what are the indications? for giving Cefadroxil or Cefadroxil monohydrate. They include infections due to sensitive gram-positive and gram-negative bacteria, including those of the biliary, respiratory, urinary tract, and also of the skin. Okay. Dosage and administration. It's to be administered orally. So for adults and children above 6 years old, body weight more than 40 kilograms, for urinary tract infections, for example. For acute uncomplicated lower urinary tract infections, example cystitis, the usual daily dosage is 1 or 2 milligrams per day in a single dose. Okay, it's 1 or 2 grams per day in a single dose. In uncomplicated or chronic urinary tract infections, the usual dose is 1 gram every 12 hours. Okay, so 1 gram BD, 1 gram twice a day for a minimum of 7 to 10 days. Okay, that's UTI, urinary tract infections. Now we go to skin and skin structure infections. So for this kind of infections, the usual dose is 1 gram per day in a single dose. 1 gram per day in a single dose. So upper respiratory tract infections, the usual dose is 500 milligrams every 12 hours. Okay. So the upper respiratory tract infections, the usual dose is 500 milligrams BD. So for group A beta hemolytic streptococcal pharyngitis and tonsillitis, 1 gram may be given as a single daily dose. As for any infections caused by group A beta hemolytic streptococcus infection, treatment should be administered for 10 days. Okay, so any infection caused by group A beta hemolytic streptococcus, Cefadroxil monohydrate should be given for 10 days. As for the lower respiratory tract infections, the recommended dosage is 500 milligrams, okay, or 0.5 grams to 1 gram twice a day. And the dosage should be reduced in patients with impaired renal function. So contraindications, Cefadroxil is contraindicated in patients who are sensitive to cephalosporin and also in patients with acute porphyria. So what are the adverse reactions or side effects, unwanted effects of Cefadroxil monohydrate? It includes diarrhea, okay, and rarely you have pseudomembranous colitis, nausea, vomiting, allergic reactions including rashes, pruritus, itchiness, urticaria, serum sickness-like reactions with rashes and anaphylaxis, erythema multiforme, toxic epidermal necrolysis, TEN, eosinophilia, and rarely thrombocytopenia or neutropenia, disturbances in liver enzymes, transient hepatitis and cholestatic jaundice, and other side effects that were reported included interstitial nephritis, which is reversible, hyperactivity, nervousness, sleep disturbances, confusion, hypertonia, and also dizziness. So what are the precautions or warnings with regards to Cefadroxil? It should not be given to patients who are hypersensitive to it, okay, obviously, or to other or patients who are hypersensitive to other cephalosporins. Cefadroxil should be given with caution to patients with renal impairment. A dose, you might want to reduce the dose. And prolonged use of cefadroxil may result in overgrowth of non-susceptible organisms. You might see a positive Coombs test. And you have to be cautious in patients with individuals with history of disease in the gastrointestinal tract, especially colitis. And as mentioned, pseudomembranous colitis has been reported. So you have to be used with caution in mothers who are nursing. And even though reproduction studies have been done in mice, it has not been conducted in humans, so you should use this drug with caution in pregnant ladies or girls. So drug interactions, as expected, probenecid can reduce the excretion of cephalosporins, so that will have a prolonged effect of cephalosporins, including cefadroxil, by probenecid. And as mentioned in the precautions warnings, positive Coombs tests have been reported with cephalosporins, and you might see a false positive result in the test for urine glucose. With regards to the pharmaceutical form, it comes in size 0 maroon and white hard gelatin capsule. Okay, packing might come in, you might see in hundreds in blister pack of tens. Okay, it has to be stored below 30 degrees Celsius and be protected from the light. Okay, so that is all from me for cefadroxil monohydrate. Okay, thank you so much for listening.